It's late. You're alone in your kitchen, the clock ticking past midnight, a bottle of vitamins sitting on the counter, glowing faintly under the dim light. You've taken them for years, haven't you? Trusting the labels, the promises, the doctors who said they'd keep you healthy, sharp, alive. But what if I told you one of those pills, those tiny, innocent capsules you swallow every morning, could be silently building a trap in your veins? A trap that could stop your heart, steal your breath, and everything you've fought to hold on to. I'm a brain doctor, and I've seen it happen. I've seen lives unravel because of a secret the system doesn't want you to know. 6 vitamins, common ones, sitting in your cabinet right now, could be raising your risk of blood clots. Stay with me, because I'm about to pull back the curtain on a truth they've buried for too long. Hit that subscribe button, like this video, and drop a comment. Tell me you're ready to hear what they don't want you to know. You're not just a senior. You're a survivor. You've lived through decades of noise, ads, experts, promises of health in a bottle. But at 50, 60, 70, 80, you've earned the right to question what they've been feeding you. I'm not here to scare you, but to arm you. Blood clots aren't just a medical term. They're a silent threat that can lead to strokes, heart attacks, or worse. And the kicker: some of the vitamins you've been told to take every day, by doctors, by commercials, by well-meaning friends, could be fueling that risk. I've spent years studying the brain, the blood, the way our bodies betray us when we least expect it. And what I've found is a pattern, a hidden truth. Not all vitamins are your friends. Let's start with the first one, vitamin E. You've heard it's good for your heart, your skin, your brain. But in high doses, especially for those of us over 60, it can act like a double agent. It's an antioxidant, sure, but it also thins your blood in ways that can backfire, promoting clotting in people with heart issues. Studies have shown that doses above 400 IU daily can increase clot risk, especially if you're on medications like aspirin or warfarin. I've seen patients, vibrant people in their 70s, end up in the ER because they trusted a supplement they thought was harmless. You don't need to ditch vitamin E entirely. Just stick to food sources like almonds, spinach, or avocados. The secret they don't tell you? Nature's doses are safer than pills. Now, let's talk about vitamin K. This one's tricky because it's essential for clotting. Your body needs it to stop bleeding when you get a cut. But too much, especially from supplements, can tip the scales the wrong way. If you're on blood thinners like warfarin, high doses of vitamin K can counteract them, making your blood too sticky, too prone to forming clots. I had a patient, a 68-year-old woman, who started taking a multivitamin with extra vitamin K because she read it was good for her bones. 3 months later, she was in my office with leg swelling, a deep vein thrombosis. The culprit? That healthy supplement. The truth they don't want you to hear is that you're likely getting enough vitamin K from greens like kale or broccoli. If you're on blood thinners, talk to your doctor before touching a vitamin K supplement. This isn't about fear, it's about seeing through the lies they've sold you. You're not just a consumer, you're a warrior, and warriors need the truth to fight. Let's go deeper down this rabbit hole with vitamin B6. You've probably seen it in those energy-boosting vitamins, marketed to keep your brain sharp and your body humming. But here's the secret they bury. High doses of B6, especially over 100 milligrams a day, can mess with your blood's delicate balance. It's been linked to increased clotting risk, particularly in women on hormone replacement therapy. I've seen it in my practice. Patients in their 60s, chasing mental clarity, only to find themselves with swollen legs or worse, a clot in their lungs. The science backs this up. Studies show excess B6 can alter platelet function, making your blood more likely to clump. You don't need to avoid B6 entirely. Your body needs it for brain function and metabolism, but stick to food sources like bananas, chickpeas, or chicken. The hidden truth? The supplement industry doesn't care about your safety, they care about your wallet. You're smarter than that. You've lived too long to fall for their game. Now, let's talk about vitamin A. You've been told it's great for your eyes, your skin, your immune system. And it is, in moderation. But in high doses, especially as retinol, it's a wolf in sheep's clothing. Too much vitamin A can lead to toxicity, with symptoms like nausea, dizziness, and yes, an increased risk of blood clots. I had a patient, a 72-year-old man, who was taking a multivitamin with high doses of vitamin A because he wanted to stay young. He ended up with blurred vision and a clot in his leg. Studies show that doses above 10,000 IU daily can be dangerous, especially for seniors with liver issues or those on certain medications. The truth they don't want you to know? You're better off getting vitamin A from sweet potatoes, carrots, or leafy greens. Nature doesn't overdose you, supplements can. You're not just aging, you're evolving, and you deserve to know what's safe for your body. Let's move to vitamin D. This one's a darling of the health world, praised for bones, mood, immunity. But here's the secret they gloss over. Too much vitamin D can raise your calcium levels, which can lead to blood vessel calcification and, you guessed it, clots. I've seen patients in their 80s, diligently taking 5,000 IU a day because they read it prevents fractures, only to end up with kidney issues or worse, a stroke. The International Osteoporosis Foundation recommends 8001000 IU daily for seniors, and going beyond that without a doctor's guidance is playing with fire. Food sources like salmon or fortified milk give you what you need without the risk. The hidden force here isn't just the vitamin, it's the narrative that more is always better. You're wiser than that. You've lived long enough to know balance is everything. Finally, let's talk about omega-3 supplements. These are sold as heart health heroes, and in moderation, they can be. But chronic high doses, especially from fish oil supplements, can thin your blood too much, leading to a paradoxical clotting risk in some people. I've seen it in my clinic. A 65-year-old woman, taking 3,000 milligrams of fish oil daily, ended up with a pulmonary embolism. Studies suggest that excessive omega-3s can disrupt platelet function, especially in seniors with cardiovascular issues. The secret they don't want you to know? You can get enough omega-3s from fatty fish like mackerel or walnuts without the risks of megadoses. You're not just a patient, you're a person who deserves to know the truth about what you're putting in your body. So here we are, at the edge of a truth they've tried to keep from you. 6 vitamins, E, K, B6, A, D, and omega-3s, can be your allies or your enemies, depending on how you use them. The system wants you to pop pills without questioning, to trust the labels, to stay in the dark. But you're not in the dark anymore. You're 50, 60, 70, 80, 85, and you've earned the right to know what's safe, what's true, what's yours. Stick to food sources, talk to your doctor, and listen to your body. If you feel swelling, pain, warmth in your legs, or sudden shortness of breath, don't wait. Get help. These could be signs of a clot. Hit that subscribe button, like this video, drop a comment, tell me you're ready to take control. Because this isn't just about vitamins. It's about waking up to a life where you're not a pawn in their game. You're stronger than that. You always have been.